Imagine the world without nurses. Nurses are Nightingale's children, unsung heroes of healthcare, reformists of health policies, safe confidants and advocates of clients, earth angels at the bedside, significant leaders of the society. Nightingale's children because we had a prime mover leader who was born to envision that it will take 200 years for society to recognize the nurse's role. Hardly without the science and art of nursing yet in her time, Nightingale made a mark as the lady with the lamp and started the education and eventually the professionalization of nursing. Unsung heroes of healthcare who have been neglected and exploited, not given enough of what they deserve as professionals, nurses remain providers by the bedside. Nurses don't share the economic gains of institutions like hospitals, as there is no fee in the hospital bills to pay for nurses' service. But she is the 24/7 companion of patients and families in the hospitals. Nurses fought long and hard to achieve the recognition of being professionals, but that is not what motivates her to care. It is nurses' intrinsic humanity that make them care. Reformists of health policies, as nurses are now engaged in many roles in many areas of the society and the world. She's an educator in school, an organizer in the community, a wellness champion in industries, a researcher, a consultant, an entrepreneur, and many more. Gone are the days when nurses are seen as assistant to the doctors because she is now a co-professional performing collaborative and interprofessional function with other members of the healthcare team. Nurses are almost always the biggest sector in any healthcare setting. Nurses have the power to bring about change. Safe confidants and advocates of clients because nurses are there for and in behalf of the clients. She makes sure her rights are protected and respected, especially in times when no one else is there. The nurses' functions are governed with the utmost consideration of the ethical, moral, and legal principles to ensure that the patient is in the core of every decision and action. Her heart beats for the clients she represents. Earth angels at bedside because from birth, a nurse was probably there to be one of the first faces that the newborn could see, the first of the touches that told. Earth angels because a young child will run to the school clinic when injury in school happens. Earth angel because she is an angel that touches you when you are in pain, runs to you when you need anything, cries with you when you feel like crying in moments of sadness, pain, and even grief. An earth angel who will be your companion until your last breath, and an earth angel who will provide the post-mortem care to your earthly body that you will leave behind after death. From womb to tomb, nurses are humanity's earth angels. Significant leaders of society because nurses care and stand for what is good for humanity. She manages not only the care but also the environment, the social dynamics and the physical spaces in healthcare settings, even the time and motion beyond the dark rates of intravenous fluids, the exact measurements of medications, the preparations for procedures, the ratings of pain, the vital signs, even the amount of urine and quality of feces, the itchy back and postpartum pains, the phantom limb sensation, the sleepless nights are matters that nurses are concerned about. Nurses stand with humanity. Nurses care for the sick and the well, the newborn to the dying, the individuals, families, organizations, and societies, social and environmental, beyond physical, reaching even the spiritual level of well-being. Nurses' purpose is anchored on what matters most to human existence: comfort, safety, serenity, peace, love, well-being. Nurses are important, and even if society won't recognize that, nurses will still care, because nursing and caring is our oath, our vocation, our profession, our mission. Now, imagine the world without nurses. God bless the nurses of the world.